Hello, today's topic is neonatal reflexes. Neonatal reflexes, also called primitive reflexes, these are important indicators of neurological development and function in a newborn. Its absence, exaggeration, or persistence beyond the normal age indicate some neurological problem. So, every newborn should be routinely checked for these reflexes. So today we'll learn how to elicit the reflex and what is the response to the stimuli, and then duration of each reflexes with some clinical implication. Neonatal reflex represents important reactions of nervous system in case of newborn. The purpose of having these reflexes are for survival, that is feeding, protecting, and for the early motor development, and these prepare the newborn to interact with the world. So the newborn brain, it is functioning at subcortical level. That means it is mediated by brainstem and spinal cord, because the higher centers like midbrain and cortex is not yet developed. As this midbrain and cortex, which are the higher centers, mature, then these reflexes are gradually inhibited by the higher centers. The neonatal reflexes can be grouped in two parts. One is primary reflex, which are the primitive reflexes. Another is secondary reflex, which are the postural reflexes. So these primitive reflexes, it is present at birth and it disappears as the cortex matures. So gradually it is getting inhibited by the maturation of the cortex. While the postural reflexes, it is not present at birth, but this appears by 1 year of life, and it forms the basis of later coordinated movements of the infant. Let's start with the primitive reflexes. So to define, primitive reflexes are involuntary, inborn stereotyped movements which is occurring in response to a particular stimuli. These are present at birth. It develops during the intrauterine life. So it is dominant during last 4 months of the prenatal life and first 4 months after birth. So 4 months before, 4 months after the birth, it is dominant. And this is divided into two groups: brainstem mediated reflexes and spinal cord mediated reflexes. So we'll see which all are the brainstem mediated reflexes and which all are spinal cord mediated reflexes. I'll be explaining each reflex with the stimulus, the response, and then the duration. We'll start with the brainstem mediated reflexes. So under this, the reflexes which are coming is Moro reflex or starter reflex, rooting reflex, sucking reflex, asymmetric tonic neck reflex, blink reflex, swimming reflex, palmar-mental reflex, and palmar-mandibular reflex. So I'll show each of the reflexes how you're going to elicit, because these are all response to the stimuli. So we'll start with the Moro reflex, which is one of the most important one. So S means stimulus, R means response. So S, what you're going to do to the baby, and R is the response, how the baby is going to react to your stimuli. And then duration. So for Moro reflex, the stimulus will be hold the baby in a semi-upright position. One hand supports head, okay, and the other hand supports body. Then flex neck and suddenly drop head at 30 degree and allow head to fall back momentarily at 10 to 15 degree with immediate re-support with your hand. So when you do this, the response will be baby's hands open and there is a symmetrical extension and abduction of the arms, like you are seeing in the picture. The baby's hands are open, there is symmetrical extension and then there is abduction of the both arms. Then after that is followed by adduction, that will be back, and anterior flexion of the upper extremities with a audible cry. So this will be the response. So this reflex appears at 28 to 30 weeks of gestation, that is prenatally. It is well established by 38 weeks of gestation. So by the time the baby is born, usually term is after 37 weeks. So when the baby is born, this is fully matured, and the disappearance is 4 to 6 months of life. And in case of preterms, you just note that arms tend to fall back during adduction. In the returning phase, in the preterm, the arm is turning backward because the anti-gravity muscles in the preterm is still weaker. So you can see the stimulus, flex the neck, then you need to let it fall back, and then response is like this. Now the clinical implication, there are certain conditions where there are abnormal Moro reflexes. If there is, that indicates some neurological problem. So persistence of Moros beyond 5 months is considered abnormal. So if this is happening, then you have to think there is severe neurological deficit in a child. So there might be central motor lesions. There might be delayed development, which is seen in cerebral palsy. And if there is exaggerated Moro's reflex, this is occurring in early phases of HIE, that is hypoxic ischemic encephalopathy. Early stage of carnicterus, there is exaggerated Moro's. Intracranial hemorrhage and CNS irritation like meningitis, also there is a exaggerated Moro's. And if there is absent or reduced Moro's reflex, this indicates depression of the central and the peripheral motor function, which are occurring in conditions like birth asphyxia, preterm babies, if mother is receiving the general anesthesia or magnesium sulfate, or there is a hypotonia in a baby, then there might be absent or reduced Moro reflex. And sometimes the Moro reflex is asymmetrical. So if there is an asymmetrical Moro reflex, then you have to suspect focal motor lesion, that is injury to one side of the brain, which is occurring in the Orb's palsy, fractured clavicle or humerus, and in case of hemiplegia. So Orb's palsy is occurring when there is a brachial plexus palsy. Now let's move on to another reflex, that is startle reflex. Here baby is lying supine and the stimulus will be sudden noise. So the response to the sudden noise, the response will be exactly like a Moro's reflex. Opening hand and extending both the arms, and there is abduction, which is followed by adduction and then flexion of the arms. So this will be the startle reflex, which is sometimes both Moro and startle is taken as a similar reflexes because the response is same, only the stimulus is different. And duration here is also similar as Moro's, 4 to 6 months is the duration. Then come to routine reflex, which is also known as search reflex. Here the stimulus will be lightly stroke the corner of the mouth like this. Lightly stroke the corner of the mouth and cheeks around the perioral area, and the response will be baby will turn heads towards the stimulus. Here the baby is turning the head towards your finger stimulus and opens the mouth, and bottom lip is lowered and tongue moves towards the stimulus, searching for the nipple to suck. So the duration onset of this reflex is at 32 weeks of gestation, well established 36 weeks, and then disappearance is by 4 months of life. So here you are stimulating perioral area, and response is the turning of the head towards the stimulus and opening the mouth. Now come to sucking reflex. Here stimulus is you place a clean finger or a nipple in baby's mouth like this, like the one you see in the picture. Response will, the baby will start sucking. So onset is 28 weeks of gestation, well established 32 to 34 weeks, and disappearance is by 4 to 12 months. Now come to asymmetric tonic neck reflex. This is one of the another important reflex. So here the stimulus is baby lies supine like this, and then you rotate the head of the baby from midline to one side, like we have turned the head of the baby to one side. Then the response will be extension of the arms and legs. Look at this arm. Extension of the arms and the leg of the same side on the side the head is turned, and flexion of the opposite arms and legs. So this is also known as, this is a fencer's posture, so also known as fencer's reflex. The appearance of this reflex is 35 weeks of gestation, well established by 1 month, and disappearance is 6 to 7 months of age. Asymmetric tonic neck reflex or fencer response. This is also called tonic labyrinthine reflex. The reason for this reflex is it facilitates the bilateral body awareness and prevents the baby's rolling from prone to supine or supine to prone. Also, it promotes the hand-eye coordination, and then breathing by preventing blockage of the airway also becomes better when the head is turned to one side. And then persistence of this reflex beyond the disappearance age will indicate cerebral palsy or any other CNS disorder. Another reflex is blink reflex. So here the stimulus is momentarily you shine the light directly on the neonate's eyes like this, and the neonate will blink the eyes. Appearance is at birth, and then there is not disappearance. This is a permanent or lifespan reflex, or it will stay lifelong. Another reflex is known as swimming reflex. Here you place the baby prone in the water or hold the infant horizontally like this, in the picture. Then the response will be the baby will make swimming movements, moving the hands and legs. So this reflex is present at birth, and then disappearance is by 4 to 6 months of age. Now come to palmar mental reflex. Here the stimulus is scratch base of the palm like this in the picture, and then the response will be the lower jaw of the baby opens and closes. So when you scratch the base of the palm, the baby will open the mouth and close. This lower jaw will open and close. So this is present at birth, and then it is disappearing by 3 month age. Another reflex is palmar mandibular reflex. Here you are going to press both the palms like this, and then response will be baby closes the eyes, close eyes, and mouth opens, and neck is flexed, which tilts the head forward. Okay, so eyes close, mouth open, and then there is slight flexion of the neck, tilting the head forward. So this is the response, and the duration is, it is present at birth, disappears by 3 months, and this reflex is also known as Babkin reflex. Okay, now let's move on to spinal cord mediated reflexes. So these are palmar grasp reflex, plantar grasp reflex, gallant reflex, stepping reflex, crawling reflex, crossed extensor reflex, magnet reflex, positive support reflex, and Babinski reflex. So let's see. So I'll explain now each reflex, how you're supposed to stimulate, and then what is the response along with duration. So palmar grasp reflex, here the stimulus will be place your finger on palmar surface of the baby's hand from ulnar side like this. This is the ulnar side. So place your finger on the ulnar side of the baby's hand like this, and the response will be baby will grasp your finger. So after putting the finger, baby will grasp the finger like this and attempts to remove finger. You try to remove your finger, the result will be baby will tighten the grasp stronger. So this reflex is onset coming at 28 weeks of life, well established 32 weeks of age, and disappear by 3 to 4 months of age, because this grasp is very strong. If the baby also catches a snake, then the snake will die, because this grasp is so strong. So here the baby grasps, and the attempt, here the mother is trying to attempt to remove the finger, or if you try to struggle, the grasp will be more tight. So this is palmar grasp reflex. Now come to plantar grasp reflex. So here the stimulus is touch the base or ball of the toe like this. In the above part, ball of the toe like this. This is the ball of the toe. So touch the base or ball of the toe, then the response will be the toes curl downward to grasp your finger. So here you have touched, and then the fingers is turning towards your finger and grasping your finger. So the appearance is at birth, and disappearance is by 9 months to 1 year. Before the baby walks, 9 months to 1 year, it disappears. Another reflex is gallant reflex. So here stimulus is, you should hold the baby in a ventral suspension. This is a ventral suspension with chest in examiner's palm. So here the baby is lying in the palm of the examiner in the ventral suspension, and stroke the paravertebral area. This is the paravertebral areas you have to stroke, middle to lower back. So from the middle you just stroke till lower back, and then if you do in the lying position, you have to put the baby in a prone position like this, and you stroke the back. So response will be flexion of the pelvis. So here flexion of the pelvis, which leads to curving of the back, and that will be towards the side you are stroking. So if you are stroking in the left side, the pelvis will curve towards the left. If you are stroking the right side, then it will curve towards the right side. So towards the stimulus, baby is going to respond that way. So onset is 28 weeks of gestation is well established by 40 weeks, and then disappearance is 4 to 6 months of age. The significance of this gallant reflex is this turning of the torso, the back. It helps in the movement of crawling and walking later on. If this reflex is persisting, then it can affect the walking posture of the baby. Now placing reflex. So here stimulus is contact of the dorsum of the foot with the edge of the table. So suppose this is a table, so dorsum of the foot is in contact with the, you bring the dorsum of the foot in contact with this edge of the table, then the response will be baby will lift the foot and place on the surface of the table like this. So onset is 35 to 36 weeks, well established 37 weeks, and disappearance is 3 to 4 months of age. So this reflex is a precursor to later voluntary walking. Then stepping reflex. Here you hold the baby in an upright vertical position like this, and gently touch feet to a flat surface. Suppose you are bringing the baby on the table or in the ground, so touch a flat surface with the baby's feet, then the response will be feet move in an alternate stepping movement like this. So the onset is 35 to 36 weeks of gestation, well established by 37 weeks, and then disappearance is 3 to 4 months. So this is also precursor to later voluntary walking. So you can see the stepping reflex. So you touch the baby's feet on a flat surface, baby will alternately lift the leg and start walking. Next reflex is prone crawl reflex. So here the stimulus is put the baby in a prone position like this on a surface, and you stroke alternate feet. So when you do that, if you do that, the response will be legs and arms move in a crawling action this way. So appearance is at birth, disappearance 6 weeks to 2 months of life. So this is a precursor to later voluntary creeping or crawling. Another reflex is cross extensor reflex. So here the stimulus is put the baby in a supine position on the surface of the bed, and hold the leg extended like this. The one you see in the picture, hold the one leg extended like this and stroke his leg on the feet or on the leg. When you do this, the response will be the opposite leg will flex like this first, then there is adduction and then extension of the leg as if to push away something. So here this is done on the right side and this is cross extension on the left side. So appearance is at birth and disappearance is by 1 to 2 months of age. Another reflex is magnet reflex. So here stimulus is baby is lying supine on the bed and then by finger try to push against the sole of the foot. So if you do that, stimulus will be knee and hip is flexed. Then you withdraw your finger slowly. If you do that, then this feet follows your finger. So it is going to extend the hip and knee and then follows your finger like you are pulling the leg with a magnet. So this is known as magnet reflex. This is present from birth till 3 months of life. So 3 months this disappears. Now positive support reflex. So here the stimulus is baby is held under his arm like this. Support his head and allow the feet to bounce on a flat surface like this, flat surface. So if you do that, the response of the baby will try to extend the leg and straighten the legs for 20 to 30 seconds to support himself. Then again they flex the legs and come to a sitting position. They cannot straighten or bear weight for a longer time. So 20 to 30 seconds they make the leg straight or extend the leg and then suddenly they flex the leg and then come to a sitting position. So this reflex is present at birth and then disappears by 2 to 4 months, and again they reappear at 6 months as a postural control reflex which persists throughout life as a standing reflex, or it becomes a reflex which is turning to standing posture. Next reflex is Babinski reflex. So here the stimulus will be baby is lying supine, then you stroke on the lateral part of the sole of the foot from heel and then just go up, then curve across the ball of the foot, up and then cross across, come till the ball of the foot. So when you do that, the response will be big toe will dorsiflex like this, that is extending upwards, and other toes they fan out. The onset is 34 to 36 weeks of gestation. It is well established by 38 weeks and disappearance is by 9 to 12 months of age. Okay, here the stimulus stroking the lateral aspect of the toe and then coming across till the ball of the foot. Look at the response, fanning out of the fingers and then dorsiflexion of the toe, dorsiflexion, fanning out of the fingers. Okay, so we completed the primary reflexes or the primitive reflex. Now let's move on to secondary postural reactions. These reflexes are not present at birth but they appear later by 1 year of age. So to define, this is a automatic reactions which develop later by first year of life after the primitive reflexes begin to fade and is controlled by midbrain and cortex. Primary reflex was controlled by spinal cord and the brainstem, and then this one is controlled by midbrain and the cortex. So purpose of having the secondary postural reactions are to maintain posture, balance, stability and coordination against gravity when body's position is changed. So this will be required throughout life. So secondary postural reactions are, number 1, postural reactions. Under this comes the symmetric tonic neck reflex and Landau reflex. Another is writing reactions. So writing reactions, head and body writing, which keeps head, body aligned vertically against the gravity. And number 3 are the protective extension and equilibrium reactions. So under this comes the parachute reflex, propping reflex. Propping can be lateral, forward, backward, and then labyrinthine righting, which is mainly the equilibrium reaction. Okay, now again let's see how you stimulate and what is the response. Symmetric tonic neck reflex. So here stimulus will be, you bring the baby in sitting up position and then flex the head like this. So if you do this, reflex will be neck and arm is flexed while the leg is extended. So when you try to flex the head, flexion of the head you do, then neck and arms flex, legs are extended. Another same position, baby is sitting up and then you try to extend the head backward. So if you do that, neck and arms extend and legs flex. So legs are doing opposite of the arm and neck. So this reflex appears at 6 to 9 months of age and then it disappears by 9 to 12 months of age. So this helps the infant to move to crawling position. Now come to Landau reflex. Here the stimulus is hold the child in a ventral suspension like this in a prone position on your palm, and the response will be head, spine and leg extend. So head, leg and spine all extend, and if you bring the head, try to depress the head forward, then the hip, knee and elbow they flex. So the duration of this reflex is appears at 3 to 4 months of age and disappears by 1 to 2 years of age. So persistent beyond 2 years is showing some abnormal neurological problem. So this is absent or incomplete in case of motor developmental issues like generalized intellectual impairment or cerebral palsy. In cerebral palsy, this reflex does not appear. In case of hemiplegic child, this reflex is seen only on one side of the body. Now come to the postural reactions or the righting reflexes. So these reflexes are responsible for certain basic motor activities which enable the baby to roll from prone to supine and supine to prone. And it also helps to get on to his hands and knees and to sit up. And these reactions also restore the normal position of head in space and helps to maintain normal postural relationship of head, trunk and limb during activities. Another secondary postural response is head and body righting. So here you put the baby in a supine position like this and body righting. If you turn the head to one side, then body rights itself. Body is also turning to the same side. And head righting. So here if you turn the body to one side, then head is automatically turning on that side. So this is head and body righting. The duration of this response is it appears by 3 to 4 months of age. It is fully developed by 6 months and this is persisting throughout life. This is a lifelong reflex. Postural reactions or the parachute reflex. So here stimulus is hold child in a ventral suspension and suddenly lower him towards the couch. So when you do this, the baby extends the arm as if it is protecting him from falling. So this is one of the protective reflex. And appearance is at around 7 to 8 months of age, fully developed by 10 to 11 months, and disappears. It does not disappear. It is a lifelong reflex, so it remains lifelong. And then absence of this reflex indicates cerebral palsy. So Landau reflex, parachute reflex, if these are not appearing at the age they should be appearing, that indicates neurological deficit, and usually it is seen in cerebral palsy child. Next reflex is propping. So this is a lifelong reflex and it is protective and extension reflex. These reflexes it prevents the child from falling. So this is of three types: anterior, lateral and posterior. Anterior propping, or also known as forward propping, begins at 5 to 6 months of age. Here, if the child is in a sitting position and then tries to extend forward, then it helps the child to extend the arm forward and assume a tripod position. Second is lateral or sideways propping. This begins at 7 to 8 months of age. This helps the child extend the arm sideways. If the child is tilted sideways, then the baby extends the arm sideways and protects itself from falling. And lastly, that appears is posterior or backward propping. This begins at 9 to 10 months of age, and this helps the baby extend the arm backwards to protect itself when the baby is tilted backward. So from any side tilted position, the child is protecting themselves by extending the arms. So this propping reflex is persisting throughout life. Another posterior reflex is labyrinthine writing. So in this case, stimulus is baby is held upright and tilted in one direction like this. If you do this like in the picture, hold the baby upright, try to tilt the baby to one side, then the baby will tilt the head to opposite side. We'll try to bring the head in the midline. So baby tilts the head in opposite direction to realign to a vertical upright position. So brings the head to the midline. If you turn the baby this side, then baby will turn the head the opposite side. So this appears by 2 to 3 months of age. It is well established at around 6 months of age, and this is also persisting lifelong, and this is related to upright posture. Sometimes this is considered as a primitive reflex also, but actually this is a posterior reflex. So the reflexes which are staying lifelong, or the permanent reflexes, are called lifespan reflexes. So example of lifespan reflexes are pupillary reflex, blinking reflex, gag reflex, swallowing reflex, withdrawal reflex, parachute reflex, propping reflex, labyrinthine writing. Okay, thank you. I hope this class was helpful, and I hope you all can elicit the reflexes in a newborn. All these reflexes are important, especially when you suspect neurological problems like cerebral palsy. You have to elicit these reflexes even later beyond the neonatal age. Okay, thank you. So next class I'll come up with another neonatal chapter. If you like and find my classes helpful, please subscribe, share and like. Thank you.